Let's talk about quality, because quality matters. I was aghast when I read a report in 2006 in the New England Journal of Medicine that looked at a group of 12 providers of colonoscopy services in a group outside of Chicago. When I asked physicians and other healthcare personnel how much variability would they tolerate in the quality parameters among a group of providers of this service, and they say, well, if one doctor finds more polyps than another, maybe if they found 10 or 15 or maybe even 20% more polyps than another doctor, it wouldn't be good, but it would be acceptable. Well, guess what? In this study, it was over 1,000%. One doctor, who took only 3 minutes to inspect the colon, found very, very few polyps. The doctor that found 10 times as many precancerous polyps took 5 times as long. In order to have a quality exam, you have to have the doctor willing to take the time necessary to inspect the 5-foot-long colon conscientiously, thoroughly, completely. In order for colonoscopy to protect you from getting colon cancer, it means we must remove the precancerous polyps. From the time a polyp is first visible during a colonoscopy, and then therefore we can destroy it, from the time it first appears until it turns into cancer, takes typically over 10 years. This is why colonoscopy is so life-saving. When we do the colonoscopy and remove all the precancerous polyps, you're now protected and will not get colon cancer. In the 25,000 cases we've performed, we've never had a patient go on to have advanced colon cancer. It works, but it matters. If the polyp rate is not high, and the report card, the number that we use to compare doctors, is now called the ADR, adenoma detection rate. And that just reflects the proportion of patients that the doctor screens that had at least one precancerous polyp. At our facility, it's a third of patients, but nationally, unfortunately, it's less than half that. You need to select a provider who has a very high ADR. If there's one piece of advice I can give you, one recommendation that you can take home, that is to be sure you select a doctor with a high ADR. Do not, and I repeat, do not go to a provider who will not tell you what their ADR is. It is very simple to measure, and the American College of Gastroenterology website even confirms that all doctors who are doing this service should measure this and should give you those results. Check the doctor's ADR. Quality matters. If you do not remove all the polyps, you're not protected from colon cancer. Quality matters. We can give 10 times the protection if the ADR is above 20%. Our ADR is above 30%. So we're giving the maximum protection against subsequent colon cancer. It is a tragedy when a patient, I hear, had a colonoscopy and then 6 months or a year later is told they have advanced colon cancer because the doctor missed it. It doesn't have to happen. We do not do a very good job of policing ourselves and selecting which doctors should and shouldn't be doing this procedure. So it's up to you, the consumer, to check. Just check on that simple report card statistic called the ADR. Pick a doctor with a high ADR. It should be above 20% at a minimum and hopefully above 30%. Get the test.